name is Brianna Plencner. I'm with HCCI as the Manager of Practice Improvement, and I have the opportunity to work with various practices on improving practice management, billing and coding, and other aspects, as well as developing resources for the field. And we're here to talk about the 5 most important things to consider in home-based primary care practice management. So number 1, keep your costs down. Home-based primary care providers are spending the majority of their time in the car and traveling to and from private residents or facilities. So spending up on medical office space and other rental and lease fees that would be associated with a formal medical office building is really not worthwhile. They're in the home, that is their office, or on the road, so don't spend up on those kinds of costs. It's also important to consider the equipment, the medical supplies, how many immunizations you're purchasing, and even how you pay your providers. Depending on the type of team you may have, some practices are traditional salary, some may pay on productivity or flat visit fees with a bonus compensation plan. So really weigh all of the aspects in your team and what makes the most sense to keep your costs down. So the second most important thing with home-based primary care practice management would be to hire the right people. Your team is so important, from the front office to your providers to the clinical staff that support you. Everyone needs to feel connected to the mission and passionate about the type of care that they're providing, especially when it comes to the providers as far as being comfortable in various home settings, hoarding, strong odors, patients with complex family dynamics, and even, just being on the road all day. It's not for everyone, so it's important to hire the right team and have the right mix of culture that's going to buy into what you are doing and make your practice the most successful. So the third important factor would be to set productivity standards. It's very important that all of your team and your providers understand their expectations from the start. Not to compromise care, but what kind of revenue does your practice have to generate in order to be able to sustain your practice and to continue caring for these medically complex patients in the home? There has to be some sort of awareness of how many visits do they need to generate that at the end of the day allows you to keep your doors open and keep providing these kinds of care, and hopefully maybe even provide additional services for your patients. So setting those expectations from the start, making sure that you communicate those with your team and they understand the importance and the why they're being asked to do so many, as well as aligning it with any organizational standards or other ACO partnerships or other people you might have to answer to on what success looks like for your particular practice. So the fourth point that is important to keep in mind is geographic scheduling. This is something that's very unique to home-based primary care or any providers that travel to the home. Your productivity and your provider satisfaction is directly linked to how successful you are at geographically planning and routing your schedules. And it's not always very intuitive. It's important to have a thoughtful, organized process that whether you use technology or whether you've developed a manual process, you can create scheduling guides, make sure your provider zones are within as much proximity as possible, and use route planning tools or be sure to at least optimize driving routes so providers are not crossing paths and that they're driving the most efficient route to get them to the patient's home and back at the end of the day as soon as possible. So the fifth and one of the most important things to keep in mind with practice management for a home-based primary care practice is to make the most of reimbursement and to also track the right data and metrics from the very start that shows the outcomes and the impact of your care. In today's fee-for-service model, although there are more value-based models that are on the horizon, you have to, in order to sustain your practice, make the most of every opportunity. From having the right documentation that supports the medical necessity of your visits, but also not undercoding. Home-based primary care providers are caring for the sickest of the sick, so appropriately billing at the right level that represents the care you're providing. And that's not enough alone. Make the most of chronic care management, prolonged services, advanced care planning. Any extra services that you're already providing or procedures you may be doing in the home, be sure to make sure you're billing for them. as well as the data and the metrics that support the outcomes of your program. So from the very start, what not only clinical quality, but practice characteristics are you tracking to show maybe your practice leadership, maybe an ACO or a payer partner. A very common and powerful one could be hospital readmission and ER utilization. Even 12 months before enrolling in the program to 12 months after to show the decrease in the utilization can be a very powerful metric. It's important to be sustainable within your practice, and that's why these considerations are so crucial to your practice success. If you have additional questions or are looking for guidance and support, be sure to visit HCC Intelligence Resource Center for more ways in which HCCI can support you and help you achieve your goals. It's so important to have home-based primary care providers that are doing the work that you're doing, and we're here to help you along the way.